All right, I think we're live now. So hello, everybody. Hi.
Hello.
Sorry we're late.
Sorry.
It's my fault.
Yeah, it's Emily's fault. And then let me put this up here so we can see some comments. Um, so yeah, hi everybody. Welcome again. Just for our weekly update. Hope you guys are staying safe out there. I'm James Gaor.
Emilie Scott.
Shea Suskin.
Awesome. Well, welcome back, guys. Today we're just gonna focus on maybe your questions if you have some. We have some basic updates for you in terms of the basics of stats, so we can just go over that. Some questions that people had about some certain treatments like remdesivir. Emily had a discussion earlier about some of um, uh, the benefits potentially of face masks and how people are misusing them. So is that really something
Shea
that's
Suskin.
helpful? So yeah, we'll talk about that. So I guess I can share the screenshot here of let's see the oops, get this up here. There we go. So that's the screenshot of basically where we're at as of today. This is updated and up to date from I think a few hours ago. So cumulative cases, you can read the things. I'm not going to read them all to you. I think most importantly, people are really interested about the overall trends. It's kind of all over the place in terms of total cases, the ups and downs. So this is the trend overall of cases in Orange County reported as of today. And these are the tests that have been being deployed. This is also something questionable as to how this is being reported and how we can actually improve testing as we move forward and during the opening up phase. And this is the testing totally done in Orange County. And this is one of the more important ones, right? So hospitalization rates of people who develop COVID, ICU utilization. And once again, it's a little bit bumpy, but overall, once again, kind of steady over the past, I don't know, a week or so. And let me see if I can see the y-axis.
That looks like an increase to
It's an
me.
increase. It's an increase over here of hospitalizations. They had a bump here yesterday, right, compared to a couple of days ago in terms of ICU utilization. So once again, 98 people today are being reported in the ICU. There's an interesting graphic from the Orange County Public Health. If you look at it on the website, and they link to Johns Hopkins, which not only do they go over some of the data points of reported cases and hospitalizations, but they actually have some baseline stats, which is really interesting that many of us have asked, right? So how many number of beds do we have? Number of ICU beds in Orange County. Really interesting statistics on poverty in terms of people in poverty in Orange County. So from a county level, these are some of the numbers in terms of resources we have. So if you look at 703 ICU beds in Orange County and 98 being hospitalized in the ICU, that's, when we're doing a numbers game, and clearly there are lives behind each of these numbers, but from a numbers perspective, the resources are there to handle any particular scenario. So yeah, those are the numbers. Unless you guys have any particular.
No, I mean, I think we've seen this ongoing lack of a tsunami here in Orange County, and that's really what everything we've done has been to prevent and what seems to still have not happened. And I would not be surprised as we might plan to see continued increases in the case counts as things open up. And what we're really looking for is making sure that we don't get that tsunami, which we haven't seen. So hopefully that never happens. So yeah.
Right. So those are the numbers. Yeah, and so I think a big topic that we've been talking about over the past couple of weeks has been about opening up, right? So we are opening up, and we've talked to certain patients individually about this, and people have concerns, fears, people are excited about it. I think it covers the wide range of emotions regarding all the next steps. So yeah, what we've seen really is this opening up phase 2 in terms of opening up retail, in terms of curbside pickup. There are talks of how we're going to do dine-in restaurants. I don't know if you guys have been up to date on that, but restaurants modifying how they operate with social distancing and proper infectious disease precautions so that we can start opening up in that manner. So I think that's really important to hear. Tennis courts are opening up, and it's all city by city. So people are, City of Irvine. I have a little infograph here of the City of Irvine and the reopening plan in different stages. They're all built on the same template from the state guidelines, but every city is able to customize it to how they see fit for their demographics. And so, tennis courts are opening up for one-on-one and one-on-one instruction. I think somebody mentioned that last week as well. So we're going to have to wait and see how this pans out, and a very cautious approach in terms of social distancing and how that affects where we're at and the cases and the disease burden in the community as we move forward. LA County has been very aggressive about making sure they want to stay at home and limiting their recommendations for people going out. Yesterday they mentioned a potential 3-month stay-at-home policy, which is very different from what we have literally across the border in Orange County. So it's really interesting to see how that really pans out operationally, where we have 2 neighboring counties having different policies, and we actually have different disease burden, different case counts, different mortality rates, literally neighboring counties. So it's really challenging to manage that. So we're going to have to keep a close eye on how that's going to be handled on a policy level. And going on that note, I think face masks.
Yeah.
So should we use them? You've noticed something,
Yeah.
and I think I'll let you talk about it.
So, well, a couple things I wanted to say first. One is it's an interesting, and I'm going to go off on a tangent here, but it's interesting psychologically to see how this has affected all of us. We've had this, almost this fear of this invisible enemy, and we have to lock down everything and make these really drastic measures. And then particularly in Orange County, we haven't seen, a bunch of our friends and relatives die. And for those of you that might have, I apologize to make it seem like I'm making it seem small. But it feels like it hasn't been this big storm of death and fear, and nothing's really changed. We hunkered down, and now they're saying it's time to open, but we haven't really ever seen anything hugely dramatic happen. And so I think that's why I'm hearing from people too, you hear all the spectrum, but there's sort of this like, maybe we overreacted. Was this too much? I never saw anything bad happen, and then we did all these things and it's still here, and now we're opening up. And then this other perspective of, oh my gosh, it's too soon, it's still out there, it's not gone yet, why are we opening up? And so I just want to verbalize that and talk about that, and talk about how it makes sense that all of us would take those perspectives when what we've seen is what we've seen. And I keep saying this on every one of these, but I want us to all continue to honor where our fellow people are with this. And so we're trusting the authorities, although they don't really know what's going on, which is why you see these disparate ideas where you have Los Angeles saying hunker down and Orange County saying, okay, we can start opening up. We're trusting them to look at the resources that are there and make sure we have our resources. And then beyond that, the goal is really to figure out what our own individual risk tolerance is. This is still out there. More of us will be exposed to it. More people will die. And so what is your risk tolerance in going out in the world? And how do you feel about approaching that? And if your friend feels a different way than you, that doesn't mean you can't be friends. And we all have to respect each other and where we're coming from. So I just wanted to put that little diatribe out there. And then masks. One of the things that's been happening, and I meant to go bring a mask for this, but so we're seeing more people in the office now, and everybody has a mask on. And I would say 80% of the people that have a mask, I see them wearing the mask, and the mask is creeping up or creeping down, and they're grabbing it and they're pulling it, or it's really tight and it's pushing against their lips and they're pulling it off their mouth. So I wanted to talk about masks, because the idea with the mask is the reason that the CDC first said no mask and then they said yes mask, and we even had a debate on this before that came out. That switch from this, okay, everybody should wear a mask, came when they realized that COVID spreads asymptomatically. So the thought was that if you have a mask on and you have no symptoms, that even just a bit of cloth might possibly decrease the spread of it. And it's not so clear. if that's the case or not. So I have two big problems right now with the way that I feel like we are using masks, and wanted to put that out there for you guys. One is that I do think it's giving people a false sense of security insofar as I have on my mask, let me go sit next to you and be in your space. There's not enough data to show a cloth mask is going to do that. So I really don't want people to, I want people to feel like they don't have a mask on, even though they do. So I really want to put that out there. And again, we all have our own risk tolerance, but I want to make sure that your eyes are open to the risks that you're taking. Like if you feel like you have a mask on and now it's safe to go in a space where you wouldn't go with a mask off, that was a lot of negatives, then maybe you know, I just want you to picture that you don't have a mask on even if you do. And then the second part is, if you're touching your mask, so bear with me, you guys might hate me forever for using this analogy, but picture your mask covered in poop. And if you touch your mask, now you have poop on your hands. And so if you touch your desk, now you have poop on your desk. If you touch your shirt, you've got poop on your shirt. So if you touch your mask, like, you have to wash your hands immediately after that. And so I've seen so many people come in and they've touched their masks like every 20, 30 seconds when they're in the office. So that's a lot of hand sanitizer. So then it kind of begs the question of, you know, if you're touching your mask and then touching the desk, or touching something, then you're actually spreading it more than if you didn't have the mask on, in my opinion. So it's such a push and pull. I know we're requiring the masks, and I'm not saying we shouldn't wear them. I just want you guys to really know what the danger is in assuming that they're covering you more than they are, and in touching them and then spreading that as after. It's just like touching your face. Just because there's a mask on and you've touched it, that's like sticking your hand in your mouth and rubbing it everywhere, which is what we're really trying not to do. So that's my diatribe on masks.
Yeah. I think that's really well said. I think it's a lot of reiteration of stuff. We had a big discussion about this in one of our first webinars. And at that point, you know, like Emilie referenced, the CDC was really kind of going back and forth. And we talked about, you know, articles that we had read where two infectious disease experts came down on different sides of it. Everybody definitely should be wearing a mask. No, it would definitely be more dangerous. So in some ways, we're just reiterating that conversation. It's different now because in most cities, they are requiring that you wear a mask. And as things are starting to reopen, you know, you're required to wear a mask in a lot of public places. And so that is what it is. But I think it's, so appropriate to have this discussion and reminder of what a mask can do and what it doesn't do, what the big picture idea is of wearing a mask. And it's just the same thing that we've been saying over and over on these is, you know, be aware of where your hands are, and try not to touch your face, mask or no mask. And if you do, just, you know, try to wash afterwards or do hand sanitizer. So.
Yeah, and when you take your mask off, you're supposed to grab back here, not on the front. So just keep that analogy. Any front part of your mask is covered in poop. And so, so you just don't want to get poop all over everything. So don't get poop everywhere.
That's good.
That's
the summary.
Story.
If you take anything home today from this webinar,
just take that visual
poop on
with
your
you.
mask. Don't touch it. So then on that note then, so what do you think? Why do you think? I have some thoughts on this, but why do you think it's challenging?
Yeah.
You know, why do we keep touching? And is there a way we can prevent it? Right. So you've pointed out what the issue is for many people. Is it because we're not used to it? Right. I mean, we're not used to wearing face masks, so it's weird to have this on our face most of the time. Is it because it's not fitting properly? So you know, we're using paper masks or cloth masks, and
our volume's low. We have to talk loud.
Yeah.
Okay.
I'm loud. You guys.
Shay's drowning us. I'll try to fix it. But speak to that in terms
the microphone.
Whether or not there's any potential solutions.
My big thing is if I was wearing some of the masks and they were fitting the way that I've seen people touching their face, I would be touching my face too, because I'm seeing people with these masks that are super tight against their mouth and it looks really uncomfortable. And then I'm seeing people with masks that aren't fitting right. So they're talking, and then as they're talking, the mask is creeping down, and then they're pulling it back up. Or opposite, it's creeping up, and then they're pulling it back down. So I don't know what to say. I mean, it's hard to find a nice fitting mask. Maybe there are, I don't know how many resources you guys have as far as trying on different sizes of types of cloth masks. Needless to say, if you have those resources and your current mask it's super irritating, then you need to ditch that mask and get a new one. If there's any way you can get a mask, or I don't know if people can add in like some sort of paperclip, or I'm not very crafty. My mom and my sister could do this, but you can pinch it around your nose so it won't creep up and down. That can help too.
Yeah.
Go ahead, Shay.
Yeah, I think even just that can help. I do see a lot of people out there wearing surgical masks, and the surgical masks do have, that's why they have that stiffer area. A lot of times I see people wearing like the part that's supposed to go over your nose that you pinch around your nose on on their chin, and so that firm piece of the mask is meant to go here and pinch it when you first put it on, and that keeps it in place much better. And yeah, as far as the cloth masks, I think it's tough. There are patterns out there that are sewn so that there's a little piece that comes over the nose, and those, like, it comes up a little bit here, and those seem to work better. But Emilie's right. A lot of people are having a hard time finding masks and being required to wear them. So.
Yeah, if someone mentioned their glasses are getting fogged, one of the ways to do that again is that pinching of the nose kind of keeps the air going down instead of back up through your glasses. So if there's a way, you want the mask to fit tighter along here and then just be looser where your mouth is and then come around the bottom. Mm-hmm. So I mean, good practice for you guys is put on your mask at home and see how long you can go without touching it. And then of course, you wash your mask. You can wash it with your other clothes in the laundry. You can rinse it with soap and water, hang it to dry. There are ways that you can manage cleaning it at home. So, yeah. So
great.
That's it on masks.
Yeah, no, that's great. I think
maybe
that was
we
a
should
big
go
thing.
back up. There was a good question.
Yeah, a couple questions. Yeah, let's see.
Yeah.
We can do some questions.
But I think it's going to start coming
asthma?
up a lot of Naomi.
Going back to work. Yeah.
Yeah, my job wants me to go back. I have health risk factors. People at home have health risk factors. How do I handle this situation? It might be inevitable, but so what are the ways that I can decrease my risk as much as possible? So I think, I think that's a good discussion to have. Part of this mask discussion. Yeah, part of this mask discussion does, segue nicely into that. It's hard to know. Some of the answer to this question is going to be specific to what your job is, how close of contact you're having with other people, if you're needing to touch other people or just kind of like within speaking distance. I'm feeling like I do need to look more into what exactly are the legal requirements at this point for employers to be providing you with, protective equipment. I know there are some regulations and restrictions, and we need to all, advocate for ourselves and be knowledgeable about what the requirements of your employer are. But again, depending on what exactly your contact looks like with people, we just keep coming back to this, but the bottom line is going to be hand hygiene at the end of the day. Just can't emphasize that enough. Like, trying to just be really aware of what your hands have touched and washing them before you touch your face. And then again, depending on how close of contact you have with other people, possibly needing to set up a system where you change your clothes before walking into the house as soon as you get home, and make sure to wash your hands when you get home. There are things like that can kind of mitigate risk. You guys have other?
The things to me that I think about when I've talked to people is, again, coming back to that individual comfort level. And in an ideal world, you would have an employer that would balance the need and your comfort level. And in an ideal world, your employer would say, you know what, you can do 90% of your work at home, and you need to be here for this much of your work, and try to be really practical about it and really creative, especially if you don't feel safe. And then if you're in a situation where your employer's reassuring you, you're safe, and you still don't feel safe, and you want to talk to us about it, we're more than happy to help advocate for you and really help you whittle down that risk assessment. What is it? Is it something that you should feel really safe and maybe you're okay, or maybe we need to, help you out and talk to your employer and advocate for you and how to keep you safe. So it's tough. We have to take it on an individual basis. That's kind of where I would take it with that.
Yeah, I mean, I agree. I think just having that conversation, and once again, the basics of infection control are hand hygiene. Face masks, if used correctly, can help prevent from spreading it outwards to people, but not necessarily prevent you from transmitting it from others. But yeah, and distancing, and once again, based on your specific job, once again, it's a case by case in terms of, once again, that risk and that risk tolerance that we discussed already, and what your comfort level is. But yeah, employers should accommodate a safe working environment for everybody.
It looks like there are more questions on masks.
Yeah.
One, Melody had a great idea. She was talking about using pipe cleaners to use to kind of reinforce the top. Someone else, Betty, commented, we can't breathe in our masks, that's why we're touching them. And so that would say to me that your mask is not a good one. If you really feel like you can't breathe, and maybe it's a little bit of getting used to, but if it's really suffocating, then maybe there's a different mask that will work better for you. Maybe it is some getting used to.
Try to take breaks. I mean, try to just have to wear it for as little of a period of time as you can. And if you're sitting here talking to us and you need to wear a mask, if you need to step outside or step out of the room and remove it, like we said, try to take it off by the straps and not by the front. Take it off, take a breather, But I hear you on that. They can feel kind of suffocating. Especially if you're needing to wear them for a long time. So.
What about kids, Shay? Someone's asking about kids.
Yeah. Kids and masks.
I was thinking about that as we went to
You
yogurt
have little kids.
And we promised the kids yogurt land. They earned it last week. It was their special treat. And we had my 3-year-old put on a mask, and it felt kind of ridiculous. I think that little kids are just so likely to be germ vectors. I think we're still understanding this, how it spreads in kids, but if there's any, risk of asymptomatic spread, I feel like kids are going to be the most likely, carriers of it. So I feel like in protecting other people, hopefully that helped somewhat, and then we just really try to watch him and to tell him not to touch things when we're in a public place. We're trying to just be crazy about that. And then I hit the jackpot on hand sanitizer this weekend at Target. I scored a bunch of hand sanitizer. So we've restocked all our hand sanitizer in our cars and bags and things like that. And so we use that liberally with our kids.
The official guideline is if they're under 2 that they shouldn't be wearing a mask. So just so you know, if your kids are that young, don't put a mask on them.
It's unreasonable to expect a 1-year-old to wear a mask, I think, is the bottom line. So once again, the risks associated with that is challenging for people to navigate. Shea pointed out a great point of discussion as to children and how infectious are they. There's still a lot of studies being done. There's a lot of debate about that. So it's not a clear answer. You go to Europe, and there's certain countries where they are permitting schools because, and seeing the data associated with that in terms of how infectious they really are asymptomatically. We don't have clear answers yet, but there's some assumptions that Shay has mentioned already that it seems like it's a reasonable assumption that they would be pretty significant asymptomatic carriers, but that study is actually being done, or studies are being done to really try to determine that. And that's part of the school openings, and how do we, the school policy is this next big, can of worms. Like when we go back to school, when the kids go back to school, what is that going to look like? Which I don't know. I don't have a clear answer as yet, but it's going to look different in some regards. So yeah, that's a short answer.
Okay.
Or a long answer on that. There's people asking about so kids.
Fred was asking Fred, are you asking what hand hygiene is? Maybe you can, if anyone has questions on what hand hygiene is, let us know.
And most airlines are not enforcing mask requirements in flights. I don't know the specifics of that, but that would seem challenging to public health efforts.
Why don't we talk about getting on an airplane?
that was a question, right? So that was actually one of the things, right? Travel, we were opening up, and everyone wants to book a flight to somewhere, or probably not, based on airline stock performance. And anyways, so traveling, and let's talk about airplanes, which most people are probably not going to be doing, but some people for work may still have to get on an airplane as part of their job, and traveling in general. So yeah, what are thoughts on that?
So one of the things that James and I were talking about is some people have had an assumption that they're going to get on the plane and there's not going to be anyone else there. But what we've heard is that in some cases
it's mixed. Yeah,
they're decreasing the amount of flights so much that the flights are still pretty crowded. So that's tough.
And it varies by airline. Was what I was reading. So each airline has a different way of operating based on that. So some will say, I forget which airline, the middle seats are empty, and some airlines not, and some airlines will guarantee if it's 70%. If it's past 70% capacity, then you can change your flight. So once again, it's all over the map. We're all just trying to figure it out.
I personally wouldn't feel comfortable getting on a plane right now. That's my risk tolerance. Again, we have to take this as individual risk tolerances and see how we feel. If you're one of my patients and you have immune suppressive conditions and it's not really essential flight, I would really try to talk you out of it, because I'd be worried about you getting on that plane. It just seems like a lot of exposure.
Yeah, it's a risk tolerance thing, and I would feel similarly. I think one of the controversial things about disease and airplane rides is the notion that it may not be from the respiratory issue, and once again, this is a question, not an answer for you, but it could just be more of the contact surfaces, meaning the air circulation, as much as we think it may be contributing to it, it actually might just be the simple fact that it's so cramped and the surfaces are so they're shared, and that might be the reason. Not only now, but in the past, people tend to get sick or report getting sick after an airplane ride. It might not be the air filters as much as it is maybe the surfaces in contact there. Once again, it's not a fact, but another theory out there regarding
I'm glad you brought that up, because I've been reading more on that, and I think that especially with us being more and more sure that this is not a respiratory airborne virus, and shouldn't be living in the air and in recirculated air in the planes or whatever, that it is more of the close and enclosed space and needing to touch surfaces. So again, if you I think what Emilie said is right. If you're have any suppression issues or meds on board, or chronic conditions that make you higher risk for this, and it's a non-essential flight, it's not the time. But there are people, patients of ours that aren't in those categories, and have flights that are really important to them. And so I think, again, knowing that it's more like the close contact with other people, and it's more touching the surfaces that's most likely the highest risk, that can help you understand how best to approach those situations and decrease your risk. I think the best thing you could do is try to bring some hand sanitizer with you on board, and I hope that you can space out the seating. So if not, I would be more concerned about that.
Agreed. Yeah. Somebody mentioned about fear and anxiety as being a mental health issue, along with being immunocompromised. We definitely agree that mental health is a huge component, right? So this is a huge issue that we're dealing with now, but also in the future. How is everything that's happening now from a medical perspective or a virus perspective to the economics and the day-to-day living that everybody has to deal with? It's going to be an ongoing issue for all of us. And so once again, we mentioned this in a previous webinar, but definitely feel free to reach out to us, your primary care doctor, your support system, making sure you have the resources you need to talk through that and get the help that you need. But that's definitely a true statement about it being an important issue. Christine mentioned here about boosting your immune system. And a lot of people have talked about that, and there's lots of questions about what can we do to help minimize the risks of getting sick. And I think it's the same old tried and true things which you guys can talk about again. But what I think is the proper assumption is, people who are generally healthy, whatever that word means to you, getting all the right components of good food, getting good sleep, movement, are clearly poised to probably do fairly well during this. Once again, there's no guarantees, but it's the best you can do. So boosting your immune system and focusing on lifestyle is a great way to not only occupy yourself, but actually taking control of yourself, right? So in these uncertain times, how can we actually regain some sense of control? And that is, once again, maybe examining your lifestyle and what are the different things you can do to support it better.
Yeah, I think there was a question about what are good supplements for kids. I guess one of the things I would say to that, I think the best way to help your kids eat healthy is to control what comes in your house and for you to eat healthy food. And I think more just trying to present your kids with different kinds of foods. And if they don't eat them, eventually, someday, maybe they will.
If there's nothing else in the house.
But also, I know it's tricky. I don't know, maybe Shea and James can speak to this too. Well, I know what James thinks. But I'm not a big fan of giving kids supplements. I think that it's not clear how beneficial that is, and I think maybe it is a little false sense of security, in my opinion. So as far as for kids, like prevention, I think it's more important that we involve them with food, maybe helping. My kids will eat things if they've cooked them, which I find really interesting, so having them get in the kitchen can help too. Shea, do you have anything you want to add about kids?
We're on board with what you guys are emphasizing, which is the most evidence-based, tried and true, definitely works approach to supporting your immune system is this overall, lifestyle stuff, getting enough sleep. So talk to us if you're not getting good sleep. There are ways we can, support you in that. That's probably the biggest one. So try to get 7 to 8 hours of sleep at night and quality sleep. Get outside every day. That's the best way for your body to get vitamin D. We know that you get vitamin D so much better from sunlight exposure than from taking it in a supplement. And vitamin D has been shown to have some benefits in immune system help, and you absorb it better from the sunlight than from anything else. So, careful with too much sun exposure and all that, and we can, help talk you through that if you're not sure. But getting outside every day, and for kids, that's huge too. They need to be playing and active for 2 hours a day every day, and hopefully some of that outside.
Same with adults. I don't get that enough, but yeah, we need to do the same.
We all need more of that. So yeah, I would emphasize those over any particular supplements. Sleep, sunshine, stress management, which I know is easier said than done. And trying to get a colorful variety of fruits and veggies. I have a 3 and 5-year-old. I know that's super hard. They also will not eat anything if it's green. So we try our best. We do smoothies. We blend stuff into pasta sauce and then hide it that way, or into pizza sauce and put it on pizzas. We try. And we just keep trying.
Food processor is awesome. Yeah. That's how I got mushrooms into our diet. Is by food processing mushrooms. And it tastes great. It's like a meaty flavor. Mushrooms, food processors, and mushrooms. I like food processor everything, and then you can put it in there. And one of the theories, and I don't know the exact number, but studies show kids need 17 exposures to a particular food to really determine whether or not they really like it or not. Adults are probably the same, but
exactly. That's huge. Don't give up.
Yeah,
too soon.
Don't give up, which is very hard to do. It's easier said than done to just keep on trying. But yeah, it's hard, and
probably very strong opinions about how they don't like a certain food.
When they're yelling at you.
Tangents, but
it's really hard. So and once again, this is an opportunity for setting habits. Once again, I think for me myself personally, I think it's been an opportunity to just really take a look at what you do have control over and how do you change things up a little bit to achieve different goals that you may have. So I think getting the kids involved with cooking has been something that we've tried our best. It's not perfect. It's far from perfect, but the more they get excited about making food, preparing food, even if it doesn't really taste good, they kind of will eat it anyway because they made it. I won't eat it, but and then it's kind of like payback.
You'll
I guess.
eat it.
No, I'll eat it. But yeah, so that's one way of I guess introducing different foods. So we talk about
it's a good question too. Yeah.
The toddler and helping cooking is that I love hearing what James and Emily are talking about. I have hope that someday I'll get to a place in parenting where right now I find it really stressful to have my kids try to help me cook.
Oh, it's stressful. It's messy. It's stressful.
I hope we
There's
get
Band-Aids.
there a little older, but that is not our method right now. So yeah, I mean, I think it's hard. I think, it also needs to be said in all this that do the best you can and don't be too hard on yourself. Definitely what Emily said, the more modeling is one of the best things we can do. The more your kids see you, incorporating veggies into every time you sit down to eat a meal, there's a vegetable involved. The more they see you doing that, the more it'll normalize it. And don't be too hard on yourself. Every day is not going to be, they're not going to get, the full plate of veggies that you would like them to get every single day. They're just going to be hit or miss.
And even if they don't get many vegetables, Christine, I hear what you're saying. Like if you have a household and you don't have full control and you're working and the kids are just not getting the nutrition that you feel comfortable with, I still would say it's very unlikely they're going to get a vitamin deficiency. It's just so rare. I mean, a lot of even the processed packaged foods are fortified.
Right, yeah.
So, more of my concern is these kids getting too much these days. By fortified, what we mean is they put a bunch of vitamins in all the foods now. So, I wonder too, like, if maybe, even if they're not, maybe the expectation of them needing to get so many fruits and vegetables, maybe you can let that go a little bit and just be comfortable with giving them a love for real food and not processed food, and it's tough.
I think it's a holistic approach that we're coming back to. I mean, their cortisol levels and their stress levels are also involved with a healthy immune system. So, not being too hard on yourself and not feeling really guilty as a parent and being able to just connect with your kids, like that kind of thing is really good for their immune system. So it's bigger than, a level of micronutrient that's going to help overall support, a healthy immune system.
And I think that goes piggyback on your follow-up question about, if you're modeling and you're doing all the right things, or still not eating their vegetables, supplements aren't going to help at all is the question. And I guess, at the end of the day, I guess what's the ultimate goal of a supplement is really the question in terms of what is it, is it helpful or not? I'll let you guys answer that in terms of...
Yeah, I guess the question is, what do you think it's going to help with?
Right, like, immune system, immune function, I guess, is my presumed, the question that many people are asking, right? So if I take a supplement, will it help me, make a stronger immune system? Will it help me fight off something during these times? I think that's acutely what people are asking. So how do you answer that with regards to supplements?
Yeah, maybe, but I don't feel like so married to one thing, and there's so many different things but I'm very married to what we've been talking about in these I know we sound like broken records, but that it's so clear that sleeping and, I'm hoping with our kids in particular now, with all that we've been through, that we've learned this lesson about having unstructured time for our kids, like letting them just be outside, inside with crafts, trying to turn off the screens and letting them kind of just be bored a little, I think is so important. And that's all good for their immune system too, right? Because it, like Shea's saying, if you the food is one thing. If you're creating stress around the food, you're actually suppressing their immune system. So I think there is that balance there. I don't know, what do you think, Shea?
I will say, I'll throw one more out, and now this is going to sound like I'm contradicting everything I just said, which I'm not, because I think that all of this that we're emphasizing is so important and, not emphasized enough. But in terms of a supplement, I do give my kids probiotics. There was a good study a few years ago now that kids that take regularly take probiotics get fewer upper respiratory illnesses, especially kids that are like in daycare. And so that was a few years ago. My kids were both just starting daycare as infants at the time. So I started doing probiotic drops, and now we do probiotic gummies, and we do probiotics. So that's something.
Cool.
But again, I don't think that's the end all be all. It's, unfortunately not that simple, but that is something that we do, and there's some evidence behind it.
So someone asked if we're sending our kids to camp this summer if it opens.
Are there any camps? I don't know.
Well, there are. If there were,
I would consider the camp, depending on how it's run and what it is and how important we felt it was for our family and our lifestyle, for the kids, for us, a balance of all of the above. Once again, it goes to the risk tolerance perspective, where, how bad do we really want to have them in camp, and how bad do they want to go to camp? I'm open to exploring it, I'll put it that way. I don't have a hard no on that. And once again, it just depends on what camp it is, how they're running it, what are the details. But I'm open to exploring it, is my non-committal answer. Cool.
Yeah.
Shay, what do you think about camps for your kids?
Yeah, I think that's tough. We haven't really mine are still a little young, so we don't typically do camps. But yeah, I mean, I don't think I have too much to add other than what James said. I think that individual risk assessment and who your kids are coming home to, if you've opened your circle and you're seeing grandparents more, and if there are other members in the family that have chronic health conditions, that's definitely something you want to take into account. But again, on the flip side of that, we're talking about holistic approach to health and your happiness and mental health and stress levels. And if camp is such an integral part of your family and it's how your kids function and they love it, and that would be such a loss not to do it. And so tricky.
Yeah. Case by case.
Agree,
yeah. Awesome.
Someone asked about hotels.
Oh yeah, hotels. That's a good question.
Back to travel.
Someone said they do want to travel, and would hotels be safe? So are hotels safe? No, but I'm not in the hotel industry. I know I've read that they are doing everything they can to make sure they can have people feel confident in staying in hotels again, for obvious reasons, in terms of infection control, limiting how many people can use the elevator at a time, aggressive deep cleaning, which once again, I don't know what those standards are, but I'm sure there are going to be some standards, and how do they abide by those. Once again, that's another, it's a non-committal answer, but it's a risk tolerance, right? I mean, if it's going to be like you need this for yourself because you're literally depressed from not being able to do so, then yeah, it's something you might want to consider. Clearly, if they are able to open and operate, then they have to conform to some guidelines of infection control. So I would just research that a little bit, and if you feel comfortable with that, then I guess that's where I'll leave it.
Yeah. And Fred's bringing up a good point about, how many cases are in the area you're traveling to. Like if you were going to New York City in the middle of March, that would be bad.
Right, that's a great, that's part of the risk assessment. Like, where are you going? Like, who are you meeting? And, you're spending your time, where are you spending your time doing? So definitely agree. It's less, travel is just one component, but it's where you're going, what you're doing, that you should take into account.
Definitely.
Yeah, and we do live in a very relatively low infection density. So, yeah. Any other questions that we missed, or any of you want to chime in on any other questions? I know there's a little bit of a delay, but I think we answered everybody's. Any other topics, Shay, that you wanted to bring up while we have everybody on?
Well, the travel was one, and we got there. So no, I didn't have anything else.
I have one more thing. I keep seeing people driving in their car alone with a mask on.
That's true. I've seen that too.
And I know we all have our risk tolerances, but I just wanted to tell you guys, and I don't know, maybe they're an Uber driver and they just drop someone off, right? Like,
I've actually left mine on accident.
Okay, so maybe that. I just wanted to put it out there. Like, I don't know if I don't think that's something that's necessary if you're alone in your car. But maybe people already know that. But I just wanted to say that. And then the other thing was, I see people in our neighborhood who are very social distance who are also wearing masks. And again, I don't want to sound judgy or like I'm making fun of people at all, because I want people to feel safe. But I do feel like you can feel really safe walking around outside if you're social distanced without a mask on. So I just wanted to give you guys that in case you didn't have that sense of that. I feel like
I agree 100%. I think the
Yeah.
counterpoint would be, it would take some mental, take off a lot of mental workings if you just assume every time you go out just to put a mask on,
yeah, maybe
versus
it's a
saying
mental
like,
health thing.
do I have, am I going to be able to social distance? Am I not? Should I bring
Right.
my mask? Should I not?
What if somebody runs up and coughs in my face?
That's true.
Yeah.
Well, no. Once again, it's really, if you make it a default and if you make it a habit, then it would be, once again,
Got it.
maybe stickier in terms of how often you would be able to do it. You wouldn't forget your mask at home because you always have your mask, is
Right.
one way of looking at it. But I
Right.
agree with you 100%. I mean, medically, there's no, the risk is incredibly low. And
Right.
you don't need one. But it just might be nice for people to get those habits, I guess, is the way to
Yeah.
look at it.
Yeah, I'm glad you brought that up as a counterpoint, James, because I know, for some people, it's just so mentally exhausting to leave the house and think about all of the things that, do I have my hand sanitizer? Should I use it now? Did I touch my mask? To try to just keep things more standardized works better for some people. And if that's, helping you cope with all of it, or just kind of have a protocol that you do every time, I think there's something to that.
Yep.
Yeah. Yeah.
Yeah, and it's a good point. All these different situations, we're all judging each other, and I'm doing it too. I'm like, wait, they have a mask on, they don't need it in their car by themselves. But it's so many good points. Like maybe they forgot, maybe they're an Uber driver, maybe they're in a rental car, and all of that. So Fred's saying the law is requiring a mask. I think that's just when you're inside stores and in an enclosed place. Wait, what? Is he saying it's not legal to go outside in LA County?
Without a face mask.
Really?
I think, well, the official, I don't know the official statement. I know in certain areas, if you're unable to social distance, then you have,
that
recommended
makes
to
sense.
wear a mask.
If you
It was
can't
like
social distance.
spaces, like in the grocery store,
Mhm.
if you're going to go inside a building. That was my
Right.
understanding of the way the regulations are.
That was my understanding.
Written?
But LA County,
Nothing?
I don't know about LA County
I could
specifically.
be wrong about that, yeah.
Yeah. But in Orange County, it is if you are unable to social distance and if you are going into an enclosed space like a retail, then yes, you do have to wear a mask to go inside.
Well, Fred's saying anywhere LA outside you have to wear a mask. So okay, fine. So
So
don't
there you
listen
go.
to me.
So I guess LA County. We can look that one up too. But yeah. So yeah, that's all we had today. Unless there's anything else you guys had questions about. Hang on for a second or two. All
Right.
Well,
Hang in
we'll
there,
call it.
everyone.
We'll call it a day, and we look forward to talking to you again. We'll see if there's any new developments. We'll update you next week, and we look forward to seeing you guys, or you seeing us.
Thanks you guys for the questions. Keep them coming. We're enjoying all the questions.
All right. Bye.
Bye.
Week.